say for example, if a child, usually I've seen is it appears in when they're school age, like when they go to reception year 1, year 2, they will be seeing, you might be getting complaints from your teacher, or in the home as well, you'll be seeing a lot of like jumping around, they want that breaks, and they're fidgeting a lot, they're talking too much, like they don't even finish the conversation, they just wanted to kind of like blurb, they want to say, they wanted to, like a very impulsive, like they don't have that control of it.
Yeah.
Because usually kids are like that. We can't say that. But in school, definitely they are very timid. Because it's all structured. But you will see those things even in the school as well. So if it is in the school one, the main thing is when you see at home some of these symptoms, you need to ask your class teacher, how is he behaving? We are noticing these kind of symptoms at home. Is it something we need to worry? Because every school has got their SEN team, like in a special education team, they will be there. So they can actually monitor the child, how is he behaving in the class? Because they are very good at picking up things. When you say something, they will see how the child is behaving, or is he mimicking anything, or is he like, kind of thing. And from there, they will do a SENCO, like, there's a team, they will refer. Either you can go to the GP. or the SENCO team, or camps, those kind of things are there in UK where you get referral. But for any concerns, if you have any concerns, speak to GP, and then they can help you out. They can see, whether it's something, that one is going on or something else going on. Okay.
Sure.
So always watch your child. I think that's what I'd say. Reinforce the good things, like positive things when they're doing some behaviors, and negative behaviors, just see the patterns of it. You need to really give that watching, because as a parent you need to observe them and see what's happening, what's not happening, and then go to the either GP or speak to the class teacher, and they can help you out the process. I mean, in the NHS it's a long waiting, but yeah.
Usually school, for example, the child is very active, hyperactive in the home because, so he got all the freedom. But when he goes to school, he's not kind of talking too much. If we never receive any complaint from school, then it would be challenging for parents to...
It will
but
be,
still it's a problem.
No, it is. It is still. It's not. It doesn't put the parents off. I won't say don't, because you're having a concern. So speak to the GP about it, and they will do a little initial kind of like questionnaire to see what they are up to, and then they can refer to. And it may be not, like, there's nothing wrong in it, isn't it? If you have a concern, always speak to GP, and we are very good. NHS is kind of good, like, how we have compared to any other countries. I think we are very fortunate enough to have that. So at least we have that initial kind of thing. We'll tick off like, okay, fine, this may not be this one. But you will see these patterns. It should be more than, you will see, not like say child is having only for a month, and then he's fine next month. No, it'll be consistently, you'll be seeing for more than 6 months. It's a patterns how you see. That's what. So it's very, you need to be like a very observant, like a detective, I think, for parents.